of addictions on individual. How many types of healths are there? Physical health, mental health, social, moral health, financial, then spiritual, intellectual health. Next one is relationship will get affected, finance and work. If the people are going for work, I have given a statistics here. According to age groups are from 18 to 25, how much people are addicted in gross population? 14.3. Out of 140 crore of people, how much people does get affected due to addiction? So this range. And 26 to 36 is 10.6 and rest is 50 to 64 is 6.3. At which age group the maximum addictions happen? 18 to 25. This age group, 18 to 25 is currently you are in this stage. And if they are comparing with genders, male and female, you can see the difference here. For individual people, how it will affect? It will affect the finances and work. If you are working, work will affect. If you are studying, you will be affected with your studies. You will get lesser mark. You cannot score more. Thing is personal hygiene, paranoia, anxiety. Paranoia is you will be not confident. Opposite of confidence is called paranoia. You will be questioning everything. Either I have locked my house, either I have locked my bike. If you are keeping anything in your bag and you are going outside, you will be more afraid. That is called paranoia. You will be not having confidence. Next thing is effect on addiction to the family. If one person is addicted in family, what happens? The whole family will be damaged. What effect might be there? You can see they will lie and steal. Question yourself. Have you lied to your parents? Question there. Lie and steal from their house. They need money. It is not less costly. It is MRP, maximum retail price. So financial difficulties will be there. They need some financial hardship. They don't have, they steal from others. First they will start from family. Financial hardship will be there. Physical and mental health will be there. Certain parents, if their father is totally drug addicted, what will happen? The family fight will come. And due to that there will be stress with living people and the forgotten victims will be children's. The children's will be good. Due to their parents, someone might get addicted and the total family will get affected due to this. Alcoholism, drug abuse in India, we have crossed 140 crore. Out of 140 crore, 16 crore people consume alcohol. In addict, alcohol is the highest number of addicts. Now 5.7 crore people needed treatment. That means some people will not be continuously using. They will be using unfrequently. What will happen? Out of 16 crore people, 5.7 crore need treatment for alcohol related. Apart from alcohol, you have cannabis. Men will be more. When you compare women, 17 times men will be higher of consuming. Then 77 lakh opioid are stimulant types of toxic. Next, third thing is effect of addiction on wider community. First thing what I have explained for personal, for individual. Next thing is family. Third thing is society. How does common people get affected? Criminal activity will happen. Sir, I am only addicted. What is wrong in that? You think first your health damages, next your family, mental health and financial health will damage. Third thing is those people having that addictive problem, they do some criminal activity. They will try to exhibit themselves. They will do rash drive, criminal activity, steal from the employer, etc. Mugging, shoplifting. They will lift something from the shop. They will sell it in another side. See, small thieves will be there. Chain scratching they will do. They will do robbery. These people, what they do is they cannot build own houses. If they are building houses, the policemen will catch. What they do is these people will rob that money and they use for the addictions. They will not at all do constructively. They will affect the wider community. Statistics I have taken from India Today. That India Today newspaper have collected some addictions worldwide. Which addictive people are higher? Can you see this red color are worldwide? 15 age to 64. They take cannabis. Throughout the world, the cannabis is the highest amount of addictions. Can you see India? India is in third place. Opioids kind of addiction, India is first when comparing rest of the world. Asia and world, when you compare, they start from 10 years. 10 years of age, they start the addictions. How community is being affected. In India, which state is having highest number of addictions? Also published by India Today. Can you see yellow color is much lesser addiction. What kind of addiction? Opioid consumption. How much people are opioid consumption in India? 77 lakh Indian people are under opioid. Under that, how many people are spread across the states? This yellow color is the place where we have lesser number of addictions. The violet color is higher number of addiction. Can you see this border area? This is Meghalaya's border area. How many countries are here? You have Bhutan, you have Nepal, you have China. Three borders are there. Places are higher number of opioid addictions. How community affects due to addiction. Now, drug abuse cases numbers in India. Those who consume drug, how much people are being filed due to drug abuses? Can you see per million population? That means 14 people out of 10 lakh people in Kerala, they consume this illegal drug. So you can see all the states here, state wise for 10 lakh of people you have this much of addictions in India. This report is being taken from National Crime Record Bureaus of Crime. How much people are being reported in 2020? 59,806 number of people are being recorded for illegal cases, and in 2019 there were 3.1 crore of cannabis. Physical health will get affected. Liver, heart, brain will get affected. Behaviors are, they involve in gambling or gaming, they will end up in chronic stress. Next thing, mental health, anxiety, disorders, pre-existing mental illness will be higher. Relationship and social effects. They cannot expose themselves in society. Thus people will be happy in exposing themselves that I am addicted to this? No. Due to the shame, what they do is they keep it in secret. Academic and career consequence. People who are addicted will get lesser marks. Question yourself. Currently you have only one job. What is that? Studying. Apart from that, do you have any job? No. Maximum students should get more than 70 or 80. If he is lesser concentrated in academic, score 70. If you are not scoring than that, in the sense you are somewhere you have locked. Either you are gaming addicted, either you are enjoying with friends, somewhere you are draining yourself. Think of that. Only one job is studying, that too I am not doing, in the sense you are somewhere deviated. Where it will end, not only consuming substance is addiction, behavior is also addiction. You will end up in loss of job and school opportunities, frequent absenteeism. You will absent for class, absent for test, etc. Everything will be there. Then where you are concentrating, question yourself. This is your primary thing. You are not concentrating here, means where you are concentrating. Question yourself. That is your addiction. It should not drain. If your parents are not earning, that means they are somewhere locked. See, currently your parents are fulfilling your dreams. Financial impact will be there. Accumulation of debt. Legal issues will come. Loss of privilege. Criminal charges will be there. Driving privileges will be there, etc. These are all for the society. Long-term impact on society is the addicted people will not contribute. Have you seen any addictive people become a Dronacharya Award, Bharat, Padma Bhushan, Padma Shri? They lose their productivity, increase the crime rate, burden to the healthcare system. From ISR and King's College of Hospital, London, they have done researches, medical researches on the short-term effect of drug addiction. Short-term, how the individual affect, long-term, how the individual affected in their hospital. They have diagnosed the addicted people characteristics, short term and long term. They have given this statistics. Studied the difficulty in aggression. Addicted people get quickly under aggression, irritability, hallucination. Their own word they fear on that. That is called hallucinations. And angry outburst, lack of inhibition, etc. Long term effect are cognitive decline. Certain people are opening their book, they cannot study. They have everything, but they will not sit and write. Why? Because they have cognitive decline. That means reasoning. Cognitive is reasoning, remembering, etc. Everything is called cognitive. Psychosis, anxiety, etc. These things are long-term effect. And short-term physical effect. Those two mental effect I have told you. Physical effect are slurred speech. Their speech will not be fluent. After consuming alcohol, can you see people's speech will be slurred. This is what they call slurred speech. High blood pressure, elevated body temperature will be there. Shallow breathing. They cannot do deep breathing. Addictions cannot do deep breathing. Rapid heart rate, drowsiness. Drowsiness means they always find sleepy. They will be not active, etc. These things will be there. And long-term physical things are organs will get damaged. What are the organs? Kidney, liver, cirrhosis. Cirrhosis is damaged liver is called cirrhosis. Completely damaged. Tooth decay, etc. Which of the following mental health problem is commonly associated with addiction? Mental issue. See, I have told you two things. Physical, how they get affected, mental. This is a option B. Depression, paranoia and anxiety. What is common behavior of addicts towards their family members? Addictive people's family. They lie and steal from their loved ones. Yes. Next thing. Why might addicts restore to criminal activity? A. To fund. To fund is the answer. What impact does addiction have on public service like the NHS? What impact does addiction have public service? It reduces number of hospital visits. Why? See, NHS is National Health Service. If more addicts are there, what will happen? The hospitals will be filled with the people. It places burden to addiction related injuries and illness. Those who are earning well are paying tax. In government hospitals, the addictive people completely occupying in the sense how they can treat the elders. Kids, they cannot treat. That is the disadvantage. What is the common mental health issue associated with addiction? B. Depressed and anxiety. Yes. Next thing. Addiction can worsen pre-existing mental illness and create a cycle of what? Option D. Dependency and emotional distress. You will be much dependent on that. How does addiction typically affect relationship? B. Option B is leads to trust issues and conflict. Nobody will trust you and conflicts will be there. Next thing. What is potential risk associated with addiction in domestic setting? Domestic means your social circle. How does it affect? What are the potential issues? Option C. Increased risk of domestic violence or neglect. Next thing. Which of the following is common mental health for long-term addict? A is cognitive decline. Mental health. Yes, you are right. What is typical physical health consequence of prolonged drug use? Livers and cirrhosis. Cirrhosis is completely damaged liver.